We will now take a look at the last compartment of the lower leg, the anterior compartment, and it will seem quite familiar. We have a tibialis anterior, an extensor digitorum longus, and an extensor hallucis or hallucis longus. Very familiar, right? Just like the deep posterior compartment muscles. We have the posterior tibialis, or tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. So we have the same muscles paired on the opposite side of the ankle and foot. The extensor hallucis longus is on page 379 in your trail guide to the body, so you may look along with that. And you can see that it is here attached onto the middle anterior surface of the fibula, as well as that interosseous membrane. Remember that posterior tibialis also is attaching onto that interosseous membrane. Okay, and then it's coming across the front of the ankle, and it comes all the way down to that big toe, the distal phalanx or phalanx of the first toe. So when you hear the word hallucis or hallucis, you know that has something to do with that first toe. So this muscle, because it attaches onto that first toe, it's going to extend the first toe. It also dorsiflexes the ankle. Notice how it crosses that ankle. And it also inverts the foot. So it's going to lift up that medial arch so it faces toward the midline of the body. Here is another picture of that extensor hallucis longus built on my mannequin. And here is your extensor hallucis longus strengthening exercise. Rubber bands are just so useful, you guys. Hang on to them, especially those nice thick broccoli rubber bands. Sometimes they also come around asparagus, both excellent vegetables to eat. So here I have my rubber band anchored again to a chair, and then it's coming across toward the medial side of my foot and looped around that first toe. So I'm extending that toe to engage this muscle. You can see the tendon popping out. And then I add on, well, and I'm also in this second photo dorsiflexing the ankle. Okay, so extending the big toe, dorsiflexing the ankle, and then also adding that inversion. So here you can really see that muscle popping up here. Now we'll take a look at stretches for the extensor hallucis longus. So we'll need to flex that big toe, tuck it under in order to stretch this muscle. You can also do this in a seated position, grab onto it with your hand and pull. So you'll also want to be pulling the ankle into plantar flexion and then everting the foot to get even more stretch. In this picture, it looks like he's supinating a little more, so you just need to angle down a little bit to get the best stretch there. Next up, we have the extensor digitorum longus. Just like we have a flexor digitorum longus, we also have an extensor digitorum longus. You can find that in Trail Guide to the Body, page 379. And we can see here that it attaches onto the lateral condyle of the tibia and the proximal anterior shaft of the fibula below that fibular head. And it also attaches onto that interosseous membrane, that fibrous tissue that keeps the tibia and fibula connected to one another. Then we follow it down. It passes underneath another retinaculum. It's a fancy ankle bracelet looking retinaculum. And it splits off into these 4 sections, which attach onto the middle and distal phalanges of the 2nd through 5th toes. So it will then cause extension of those toes, dorsiflexion of the ankle, and it also everts the foot, pulls that lateral arch of the foot out away from the midline. So here it is built on my mannequin. I don't have the retinaculum on there just yet because we still have one more muscle. Now, this I'm just throwing into the mix so that you know maybe it exists, the peroneus tertius. All right, it's not present in everyone, and some texts actually consider it part of the extensor digitorum longus. So I usually do not build this as a separate muscle. And the attachment points, if it does exist, are the distal third of the anterior fibula, and then to the superior aspect of the base of the fifth metatarsal. And it is responsible for eversion of the foot as well as dorsiflexion of the foot. So it's almost like another peroneal muscle, and that it causes that eversion of the foot, and it lives on that lateral side of the ankle. All right, so here we have the peroneus longus, the peroneus brevis, and the peroneus tertius. But you don't need to know that muscle too much for your tests. I just want you to know that it does exist, okay? Now, here we have the extensor digitorum longus strengthening exercise. So we have our broccoli rubber band around those lesser four toes. And here I'm extending those toes, dorsiflexing at the ankle, and then everting at the subtalar joint. Let me just show you here, right? This is the opposite of our ankle sprain position. Usually we sprain that ankle, remember, in a plantar flexed and supinated or inverted position. So these muscles, when we strengthen them, we are much less likely to get a sprained ankle. And here's how we would stretch those muscles, similar to the extensor hallucis longus. We need to stretch those toes into flexion, plantar flex the ankle, and then invert the subtalar joint. Now we'll take a look at the tibialis anterior, similar to the tibialis posterior. The tibialis anterior connects to the lateral condyle of the tibia, the proximal lateral surface of the tibia, and the interosseous membrane. Then it comes down across the front of the ankle and it attaches onto the medial cuneiform bone and the base of the first metatarsal. It's responsible for dorsiflexion of the ankle as well as inverting the foot. So this muscle, because it attaches medially, is going to cause that medial arch to lift up and face inward. Lift up and move medially toward the midline of the body. Here it is built on my mannequin. So it's up here and then coming down and across. And you can't see those distal attachment points too well. The flexor hallucis longus, sorry, extensor hallucis longus is in the way. And there we see it. All right, and here is our tibialis anterior strengthening exercise, where I have the rubber band coming from lateral to medial trajectory, wrapping and slinging around that big toe distal metatarsal joint, metatarsophalangeal joint-ish, okay? And then I am going into an inverted position as well as a dorsiflex position of that foot. So here's my sort of neutral foot on the left. In the middle picture, you can see that I am starting to invert the ankle and then adding that dorsiflexion on. Now, whoops, didn't mean to do that. Up in this right-hand side picture, here's a picture of an inverted foot or a supinated foot. There's maybe not too much adduction there, but this is a position that one could walk around in to strengthen the tibialis anterior. And again, because it does not cross the knee, you can do this in a seated position on a rolling stool or rolling chair. And Here are some more exercises to strengthen the tibialis anterior, including sitting in a chair with the heels on the floor and simply lifting and lowering the feet into dorsiflexion. Here is a device that is called a DARD, Dynamic Axial Resistance Device. This is something that my kinesiology instructor actually gave me the directions to make. I just went to the hardware store and picked up the items and then ordered a plate, like a plate that you would put on a barbell. All right. And then I worked on strengthening my tibialis anteriors, which were weak due to my scoliosis and due to habits that I had built up over the years. And that led to plantar fasciitis. So I have my own journey here. And that was in my early 20s. That's been many years, and I haven't had the plantar fasciitis come back since. Because I have all this fabulous information at my fingertips to keep my body strong and healthy. So I'm glad that I'm able to share this with you. So now here we also on the lower left-hand side see a dorsiflexion exercise to strengthen all those dorsiflexors, that anterior compartment. We have a TheraBand wrapped around the edge of a chair, similar to my rubber band exercises, and then wrapped around the tops of the feet. Now I showed you in another video how to strengthen the dorsiflexors with a band looped around both feet and then just simply pushing one foot forward. So you can do that type of a looped resistance as well. Then we have an ankle weight. I don't know if there's actually forefoot weights, but you could use a wrist weight or an ankle weight and put that around the foot and then use that as a resistance tool as well. Another option is to walk around on your heels and really think more about that heel strike and trying to keep as much dorsiflexion in the foot as possible as you're walking. Another option would be to sit in a rolling stool and just walk around on your heels. Then to stretch, we want to go in the opposite direction. So we need to get into plantar flexion and then perhaps also add some eversion of the subtalar joint. All right, here's a look at the retinaculum, which again, you don't need to know for your test, but I find it fascinating and interesting to take a look at these straps. So we have this Y-shaped strap down at the ankle, holding the tendons of the anterior compartment in place. And it's attached to the Y-shaped band to the surface, the upper surface of the calcaneus, and passing in front of the anterior compartment muscles. At the divergence, one end connects upward toward the tibial malleolus, the medial malleolus, and the other connects downward and medialward toward the plantar aponeurosis. All right, so we see that coming down underneath the foot. And then the opposite or the other slip coming across to that malleolus, the ankle bone. And here I have it built on my mannequin. And then there is another ankle bracelet, a high ankle bracelet. All right, it doesn't go all the way around though, right? None of these do. It's just like looks kind of fancy there in the front. So the superior extensor retinaculum, it is attached to the lower end of the fibula as well as the lower end of the tibia. So it's just pretty much a straight shot coming across that high ankle. And here it is again, built on my mannequin. All right, shin splints. They are a common anomaly of the lower leg. So there's theories on what shin splints are. There's not necessarily a determination of exactly what it is or if it's the same anomaly in each person who is diagnosed with it. So what is a shin splint? It's pain along the shin bone. But what is causing that pain could possibly vary from person to person. It could be overuse of a muscle. It could be inadequate balance of strength and or flexibility. So overuse could be like someone who's a runner who hasn't been running marathons. I gave you this example before, I believe, in another slideshow, right? Where all of a sudden they decide they're going to run a marathon and they've only been doing 10Ks, okay? And then they've done a big long run and then that flares them up. Okay, but it could also come on slowly over time from inadequate balance of strength and flexibility. So theories as to what's causing that pain, it could be small tears in the muscle that's being pulled off the bone. It could be an inflammation of the periosteum. It could be inflammation of the muscle or muscles or tendons. And it could also be a combination of the above. And high-risk populations, people who have flat feet, as well as people who have rigid arches. So either extreme. Runners, dancers, military recruits. That situation, again, might be someone who has just entered the military and they're going through boot camp, and all of a sudden they're put underneath a lot more physical stress than they're used to. Basketball players, tennis players, soccer players, hikers. So how to heal. Now, I'm not teaching you to become physical therapists, but this is just general information to share with you. All right, I'm not telling you that you have the ability to go and treat people, because I do not have that authority to tell you to treat people. Okay, but just sharing this educational information that rest, ice, and anti-inflammatories do tend to help this condition. Wearing proper shoes, getting massage from a practitioner who really knows what they're doing, they're not causing more inflammation, stretching, and strengthening. And of course, physical therapy, going to see someone who is trained to administer ice or heat, massage, and exercise prescriptions. All right, so we want to correct those muscle imbalances that caused this tibial stress, medial tibial stress syndrome to occur in the first place. And then work on posture and gait. Remember, we were talking about gait just recently, and we were looking at the wear of your shoe patterns. Now I want you to take a look at how many muscles there are in each of these ankle and foot movement categories. Notice how there are more muscles in the plantar flexors group than there are in the dorsiflexors group. So we can imagine that we might have some issues because there's much more power and strength and force coming from the sole of the foot and the posterior compartments, than from that anterior compartment. So we need to make sure that we adequately stretch our plantar flexors and we adequately strengthen our dorsiflexors to help keep the ankle nice and healthy and prevent injuries. Then also take a look down at the bottom at the inverters and everters, and notice how there are a couple more inverters than there are everters. So we also tend to be stronger in the inversion muscles than we are in the everters, which are mostly there, right? Our peroneus muscles, our lateral compartment muscles, as well as that anterior compartment extensor digitorum longus. So we need to strengthen those peroneus muscles more and stretch those inverter muscles. And here's just a nice slide to review the anatomy of the lower leg. You now know where the gastrocnemius lives. Yeah, that's this most superficial muscle at the back of the calf. The peroneus longus and the peroneus brevis, can we identify those? Here's the longus coming from that fibula head. And then underneath it, we can see that peroneus brevis. The soleus, living right underneath the gastrocnemius. And we see it posterior to the peroneal muscles. The tibialis anterior. We see that laterally as that most anterior muscle. The extensor digitorum longus, sneaking out here underneath that tibialis anterior. The extensor hallucis longus. Remember, that's the big toe. So you see that coming out and all the way down to that big toe. The extensor digitorum longus, because I skipped over that one, coming all the way down to show you these toes on the left side of the screen. And then here are those peroneal retinacula of the lateral ankle. You can see they're cut off here. And then the extensor retinacula over here. And they're also over here, just chopped off.